Hello everyone, now let us discuss about NCCI Edits. The Medicare National Correct Coding Initiative, which is nothing but NCCI, National Correct Coding Initiative, was implemented to promote national correct coding methodologies and to control the improper coding leading to inappropriate payment. At a national level, the CMS identifies individual services that are components of more inclusive services using NCCI edits. They are designed or designated to promote correct coding and to prevent improper payments by bundling the component codes into more inclusive code. The component services that are billed separately from the more inclusive service are denied unless there is an exception. And each edit has column 1 and column 2. Column 2 is for either HCPCS or for CPT code. If a provider reports the two codes of an edit pair for the same beneficiary on the same date of service, the column 1 code is eligible for payment, but the column 2 code is denied unless a clinically appropriate NCCI P2 PTP. PTP is nothing but procedure to procedure associated modifier is also reported. Unless a clinically appropriate modifier is reported, if an edit pair is performed for the same beneficiary on the same day of service, column 1 code is eligible for payment and column 2 code is denied. And each NCCI code pair is designated with a superscript. There will be a superscript over each NCCI code pair. It can be 0, 1 or 9. If it is 0, it indicates that the codes are always bundled and do not submit a modifier for exception. So you cannot code these two codes simultaneously. If superscript 0 is there. If superscript 1 is there, exceptions may apply. Submit the appropriate modifier and the documentation is required in the patient's medical record. If it is 9, not applicable, the code pair is no longer bundled and no modifier is needed for the purpose of noting an exception. So these three are the superscripts that are present or designated over each NCCI code pair. There must be documentation in the patient's medical record to support all exceptions. Whenever exceptions are coded with appropriate modifiers, the documentation should be appropriate. And if you feel your documentation supports an allowable exception, you may use one of the NCCI associated modifiers. It can be 59, XC, XS, XP and XU. And prior to July 1st, 2019, the multi-carrier system MCS required that the modifiers be appended to column 2 code of a PTP edit to bypass the edit. As of July 1st, 2019, with the implementation of CR 11168, the Medicare will allow modifiers 59, XC, XS, XP and XU on column 1 and column 2 codes. They can be applied to both the codes in each column to bypass the edit. And the NCCI contains mainly two types of edits. Mutually exclusive edits and the second one is column 1 and column 2 edits. Mutually exclusive edit pair procedures or services that the physician could not reasonably perform at the same session on the same beneficiary. Mutually exclusive edit pairs are the procedures or services that a physician could not reasonably perform at the same session on the same beneficiary. For example, NCCI lists 19102, which is nothing but biopsy of breast percutaneous needle core using image guidance, as mutually exclusive of 19100. 19102 is mutually exclusive of 19100, which is nothing but percutaneous needle core not using image guidance. The provider would not expect that the surgeon would perform both services on the same date at the same anatomical location for the same patient. So pair 19102 and 19100 are mutually exclusive edits. Coming to column 1/column 2 edits, they describe the bundled procedures. That CMS considers the code listed in column 2 as lesser service. Usually column 1 is coded with more extensive code and column 2 code is considered as a lesser service which is included as a component of a more extensive column 1 procedure. For example, NCCI contains an edit bundling 49550. 49550 indicates repair initial femoral hernia any age reducible. So 49550 has an edit with 49500. 49500 indicates repair initial inguinal hernia age 6 months to under 5 years with or without hydrocelectomy reducible. In this case, 49500 is more extensive procedure. Hence, it is listed in the column 1, whereas 49550 is lesser procedure which is included in the extensive procedure 49500. Now let us see some of the examples. A patient undergoes petrisium surgery in the right eye. During the 90-day global period, she is hit in the left eye with a bungee cord, causing a traumatic cataract and vitreous hemorrhage. Immediate surgery is scheduled. So what is the correct coding for surgery? Correct coding for surgery is, first you will code 67036 along with 79 modifier and LT modifier. 67036 is performed for vitrectomy because there is a vitreous hemorrhage and traumatic cataract. Additionally, 66984 along with 59, 79 and LT modifier for the cataract removal. So why are we using the modifiers? NCC Edits bundles 66984. 66984 is nothing but cataract removal with 67036. These two codes are NCC Edits, and NCC Edits bundles 66984 cataract removal in 67036 vitrectomy code. When you know preoperatively that both procedures will be performed, it is appropriate to unbundle by appending modifier 59 to 66984, and modifier 79 is used to indicate that these surgeries are unrelated to the petrisium surgery for which the patient is under global period. These two surgeries are unrelated to petrisium surgery to indicate that 79 modifier is also appended. Now let us see example 2. This is for different surgical site. One lesion is excised and another is biopsied. So here both two lesions are there. If you see the question, one lesion is excised and another is biopsied, both on the right lower lid. Both lesions are performed on the right lower lid. So what is the correct coding? First you will code 67810 along with RT modifier. RT modifier is indicated to indicate the right side. 67810 indicates for excising an eyelid lesion except for a chesilian without closure or with simple direct closure. And similarly 67810 is for biopsy. So here you code 2 units of 67810 and for the second unit you will append 59 modifier. If you do not append 59 modifier, the insurance company would assume that biopsy and excision involve the same lesion. So to differentiate, you append 59 modifier for 67810. Let us see one more example. For the convenience of patient, an NDYAG capsulotomy is performed on the left eye the same day as cataract surgery on the right eye. So here correct coding is first 66984 along with RT modifier for cataract removal. Additionally, 66821 for NDYAG capsulotomy along with 59 modifier along with LT modifier to indicate left side. RT is indicated for right side. Right side cataract surgery is performed, and for left eye NDYAG capsulotomy is performed. It would not be enough to just append modifier RT and LT. Modifier 59 is needed to unbundle an NCC edit. These two codes are bundled, and to unbundle the NCC edit, 59 modifier is appended along with 66821, which is nothing but NDYAG capsulotomy. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.